We're facing some extremely cold weather across the country right now, and cold temperatures can be dangerous. I spoke with the cardiologist, Dr. Fahmi Farah, to find out how we can protect ourselves from winter-related illnesses.
Any kind of extreme weather can put a strain on the heart, and it can cause the rate of heart attack to go up. We see this especially during the winter months, and particularly in areas where there's heavy snow. People who get out there to shovel snow, that can cause somebody to have a heart attack who's not used to that kind of workload.
How do we identify that we have a heart attack or that we're going to have one, and how do we prevent that?
So somebody who's having a heart attack, some of the classic symptoms would be chest pain. Sometimes they will explain that as crushing chest pain, a lot of shortness of breath, sometimes along with heavy profuse sweating. And sometimes people explain the symptom as like a sense of an elephant sitting on the chest. All of those are pretty classic symptoms of heart attack. You should seek help immediately. There are some atypical signs as well, particularly women. They fall under this class where they won't have chest pain, but they'll have a lot of nausea, vomiting with profuse sweating and shortness of breath. Those are some of the atypical signs. If you're having those, you should also seek help immediately. How do we prevent it? You have to see your doctor regularly, get your heart checked, especially if you have risk factors like high blood pressure, high cholesterol, diabetes, family history. Now, sleep is one of the risk factors as well. Sleep disorder like sleep apnea, that needs to be checked. If you're somebody who smokes, I encourage everybody to stop smoking. Those would be the risk factors that we can work on.
Frostbite is a serious problem in the cold. How do we identify that we have frostbite or that we're going to get frostbite?
Yes, it's actually not uncommon to get frostbite during the winter, and that is something to be cautious of. Some of the earlier signs of frostbite would be, skin discoloration. Usually starts with a reddish change to the skin, and then if it progresses, it'll actually lose that color and progress to something like bluish, purplish. If it's starting to get purple to black, that's an ominous sign. That just means that the circulation's been completely cut up to that area. And if help is not sought in a timely manner, you could actually lose that part of the body.
Now, it brings me to my next question. How do we prevent this?
Of course, by not exposing yourself to that cold area for too long. And if you start to see those early signs, to remove yourself from the cold immediately and get yourself into a warm area. The advice is not to submerge that body part to hot water, but rather lukewarm water, and then call for help.
Winter can also result in hypothermia if we're not careful. How do we recognize that we're having hypothermia and not just super cold?
Yes, so hypothermia is more of a systemic problem. When we have hypothermia, our core body temperature will drop to below 95. And typically, people will be pretty sick. They will have, they're going to get tired very easily, kind of lethargic. They're not going to be all that alert. Sometimes they'll have a hard time breathing. The heart rate typically slows down significantly when you're having hypothermia. Sometimes people can have loss of consciousness, so they can actually pass out from this too. So if you have any of those signs, you need to remove yourself from that as quickly as you can, warm yourself up and get help. Hypothermia is a pretty dangerous condition. It can slow down the heart to the point where the heart can stop and can cause cardiac arrest. So we do advise those who think that you're experiencing that, you do need to seek professional help and call for EMS.
That was cardiologist Dr. Fahmi Farah.